Hi, my name is Luann Lonergan and I'll be your registered nurse today. Can you tell me your name?
Lori Hurdle.
Wonderful. And your birth date?
3/8.
Alrighty, good. I'm going to just check. Good job. All right, Lori, today I'm just going to do a little bit of a musculoskeletal assessment, and then I'm going to show you some range of motion exercises. Okay?
Okay.
All right, first I'm just kind of comparing your muscles, and actually I'm going to lift the bed up a little bit, if that's all right, because it's a little low for me. All right, did you have a nice weekend?
I did.
Okay,
I did.
Good, good. All right, good. So I'm just really looking at her muscles right now, her sizes. I'm comparing side to side. They look real good. If I thought that they were abnormal size, one was a little larger or smaller, I could measure. So I'm just going to do that. I would get a measuring guide, and I would use the centimeter. And I'm just going to measure you, Lori, just to make sure. We're about 25.5 centimeters, and I'll go on to this side. We're about 25.5 centimeters, so you're equal on both sides. So that's good. I'm going to look for any contractures right here, shortening of the muscle or tendons. I don't see that at all. Are you having any pain anywhere in your joints, Lori?
Mm-hmm.
Beautiful. That looks real good. Now what I want you to do is just hold your arms out straight, and I don't notice any tremors going on. I'm looking for any fasciculations anywhere, which are small twitches anywhere. I don't see that going on at all. I'm going to have you squeeze my fingers, both. Wonderful. I'm going to grade that as a 5. That's full strength, and she's got real good strength. And then I'm going to have you hold your hands like this and push up, both comparing side to side, and she's resisting. So that's beautiful. She's at a full strength also. I'll have you turn down, press down. Beautiful. Now I want to get the tops of her thighs. That's also a 5, and push on out. Wonderful. Things look real good. So Lori, I'm going to have you lay down. We're going to do some range of motion exercises, and I'm going to have you come a little closer, just to the side a little bit. I'm going to put your head down, the other down, and I'm going to lift up the bed a little bit, and I'm just going to talk through those exercises so that you'll be able to do those yourself. So right now I'm going to do passive range of motion, where I'm going to do that for you. Okay? You look a little uncomfortable with that pillow. Let's get that situated. Good. All right, that looks real good. So I'm going to just kind of note, I'm just checking her skeletal structure here. I don't see any deformities here. Her joints, I'm not seeing any kind of swelling in those joints, so that looks good. I'm going to do these range of motion exercises, passive range of motion, and I don't want it to cause any pain. So if there's any pain or discomfort, tell me right away. Okay, good. First, I'm going to just have you lift up your head, and I'm going to just take out the pillow for a moment, and we're going to get a couple of her neck. So I'm going to really just have her flex forward and extend back. Flex and extend. You're okay?
Mm-hmm.
Flex and extend. Beautiful. Now I'm going to laterally flex her and back. Lateral flexion and lateral flexion. Beautiful. Let's put that pillow back, Lori. Oops. Okay, now I'm going to get to the shoulder joint, and I'm going to do some flexion and extension. Flexion and extension, and flexion and extension. Beautiful. Did that feel okay?
Mm-hmm.
All right. Now I'm going to do some other ones. I'm going to abduct and adduct, coming all the way across her body. Abduct and adduct. Kind of nice and slow. Abduct and adduct. You're doing okay?
Mm-hmm.
Wonderful. Then I'm going to kind of put it out to the side, and I'm going to do some external rotation and internal rotation. External rotation, internal rotation, external rotation, and internal rotation. While I'm here, I'm going to just flex up that elbow, flex and extend, flex and extend, flex and extend. Good. And then I'm going to do something on the forearm. I'm going to supinate is here. Pronate is turning that. Supinate, that's the palm up. Pronate, supinate, and pronate. So that looks real good. Now I'm going to just get to her wrist area, and I'm going to flex her wrist, extend, and hyperextend. Does that feel okay?
Yep.
Flex, extend, hyperextend, flex, extend, hyperextend. So that's real good. Now I'm going to just take those fingers and flex. Is that okay? You're a little cold, Lori. And extend, flex, and extend, flex, and extend. Beautiful. Those look good. Now I'm going to abduct the thumb, adduct, abduct, adduct, abduct, and adduct. And then I'm going to perform opposition of the thumb. I'm going to touch the thumb to each of the fingertips. Beautiful. Beautiful. Opposition. That should feel good on those joints. And I'm not, is there any pain at all? No. It's really a nice fluid movement with that. Real good. Now I'm going to go to her hip area, and I'm going to just reach under here, and I'm going to flex and extend, flex and extend, flex and extend. Good. And I'm going to really go underneath here and real good support, and I'm going to abduct and adduct. Is that okay, Lori?
That's fine.
Abduct and adduct, abduct, and adduct. That's real good. Now I'm going to really turn the foot towards the other foot, and I'm going to internally rotate and externally rotate that hip. So it's really a hip movement. Internally rotate and externally rotate. Internally rotate and externally rotate. Good. Now I'm going to go down here. Do you mind if I take off your socks so they can see that? Oh my, she's got some painted toenails. That's beautiful. So I'm going to dorsiflex and plantar flex. Dorsiflex and plantar flex. Dorsiflex and plantar flex. Beautiful. Then I'm going to take these toes and I'm going to flex and extend, flex and extend, flex and extend. Okay, that's real good. Then there's just two movements. I'll put your sock back on here. There's two movements because of when she's in bed, we can't really get to hyperextension very well. I'm going to have you turn on your side, Lori, that you're comfortable, and I'm going to hyperextend her shoulder here. So being very careful to hold underneath here, I'm going to hyperextend that and return. So we're hyperextending. Is that okay?
That's fine.
And hyperextend. Beautiful. All right. And I'm going to do the same thing with her hip then, because we didn't have a chance to hyperextend that. So I'm going to pull that back, hyperextend of the hip, return, hyperextend, and hyperextend. All right, Lori, did that look like all the good movements we should have done?
Mm-hmm.
All right, I'll have you turn on your back then, and I'm going to put your head up a little bit, and we're going to just move you up. We're going to get you into the wheelchair. And for the purposes of this demonstration, I'm going to want you to have a weaker side. So your right side will be weaker, okay? And when we're doing this, I'm going to put the head up, and I got to put the bed down pretty far down so that you're going to be able to reach the floor. And I'm going to get a wheelchair, but first of all, I'm just going to get you positioned. Okay? All right, I think that should be good for you. So you're kind of close to the end of the bed. I'm going to have you just move your shoulders a little bit. You're close to the end of the bed. And what I'm going to do here, I'm going to go underneath her shoulders, get real good, kind of a nice firm grasp underneath her shoulders, avoiding her neck. And I'm going to go underneath her thighs. And I'm going to pivot my feet then. So on the count of 3, you can help push with your strong arm, okay? 1, 2, 3. We're going to just pivot. Beautiful. That feel okay?
That feels fine.
All right. Now, I really would want your shoes before I transfer you, Lori.
Right there they are.
All right. And are they?
They're non-stick.
They're non-stick. Good. So we're going to get those shoes on because that is really important. I'm going to get the wheelchair. And I'm going to kind of angle that wheelchair and lock the wheelchair brakes. That's a real important part of this. And I'm going to use a gait belt because when I'm assisting someone, I want to make sure that I've got something to hold on to. So I'm going to put that gait belt around you, Lori, like a belt. It'll be kind of snug just for the transfer. Have you had a gait belt before?
No.
On? Okay. All right, so I'm going to get that kind of snug. Fit about 2 fingers. It's a little bit snug, and then I'll be able to loosen that up when I get you in the chair, okay?
Okay.
All right, sometimes I like to get this out of the way. All right, so I'm going to just scoot you forward a little bit. There you go. And this you're going to be able to help push up with this hand, Lori. Okay. This one I'm going to kind of keep tucked on in here. Do you see the wheelchair?
I do.
That's where we're going to go. So I'm going to count to 3. I'm going to rock you a bit back and forth. And on the count of 3, I'm going to roll you up. And then I'm going to have you just take some tiny steps back. And then you can use your arm here to kind of feel for that wheelchair armrest. Okay?
Okay.
All right. So I'm going to kind of come over here. And then I'm going to kind of straddle. I'm going to go here. And actually, I'm going to have you turn your head. And I'm going to have you get real close to me, Lori. Okay? So on the count of 3, 1, 2, 3. Beautiful. Look up, look up. Turn, turn, turn. Okay, you can reach there. Now I'm going to do the same thing going on down. You did an awesome job. Okay, thank you.